I think everybody wants affordable health care for all Americans. They know that this will take courage. It took courage to pass Social Security, it took courage to pass Medicare, and many of the same forces that were at work decades ago are at work again against this bill.
And House Speaker Nancy Pelosi is hoping that one of the forces against this bill, the filibuster, fades away.
And she's got a very tough job this week trying to find the votes to pass health care in the House. Top Line begins right now.
Hello and welcome to ABCNews.com's Top Line. I'm Rick Klein.
And I'm Jonathan Karl.
Every day at noon Eastern Time, we bring you the latest headlines, political reporting and analysis, everything you need to know about politics before you head out the door to lunch, and you keep it going all day long. It's twitter.com/The Note. We invite you to answer our question of the day. And with that, John, your first Top Line.
Waterloo moment. This story of the week this week is healthcare reform as Democrats try to plot a strategy to pass it with Democratic-only votes. This is going to be a very tough job, and the stakes are high. You heard from James Carville this morning on Good Morning America saying that this would be the president's Waterloo if it goes down, sending a message, Carville says, that Democrats just can't govern.
And the problem is that James Carville may feel that way. You've got a lot of centrist Democrats who feel like if it does pass, it means a Waterloo for the party. There's no consensus inside the party about whether it's better to have something or not have something at this point. They're pretty far along. Lincoln's left. Senator Blanche Lincoln has a Democratic primary challenge, and it is the Lieutenant Governor of Arkansas, Bill Halter. This is liberals' dreams come true. They have been after Senator Lincoln for a long time now. It may not help Democrats hold on to this Senate seat in Arkansas one bit, and for Blanche Lincoln to have to expend some resources and maybe lose a primary to a liberal challenger. But it actually may help the health care reform effort, because this kind of energy on the liberal left could be forcing her into the fold on health care.
But I'll tell you something, Rick. One thing that Democrats have been able to say up until now is that when you look at the Senate playing field, it's been the Democrats that have had relatively easy primary fields and the Republicans that have had these big divisive primaries. Now you have in one of the hottest Senate races of the year some Democratic infighting, and that makes them very uncomfortable. Next up, deal or no deal. A Republican Congressman Nathan Deal is leaving the House of Representatives to run for governor of Georgia. Why does this matter? Because he is leaving. He was a Republican no vote against health care reform. With him gone, and he leaves effective Monday, now Nancy Pelosi only needs 216 votes to pass health care reform instead of 217. As you know, every vote counts.
This is a gift to Democrats. You are letting a moderate, a blue dog Democrat off the hook here. If and when they were able to bring it up, this is one less that they have to get to for the magic number. Yeah. Nancy Pelosi, you've got to be very happy with this news. A rare bit of good news.
A rare bit of good news.
And Texas Showdown. Tomorrow is primary day in the Lone Star State, and one of the marquee matchups of the year taking place, pitting the governor of Texas, Rick Perry, against the longtime senator, Kay Bailey Hutchison, in the Republican primary for governor. Rick Perry has been governor longer, I think, than any governor in the country, but he hasn't had the same negative implications around that a lot of governors had. He's still very popular. He's favored to win tomorrow. The big question is going to be whether there's a runoff.
And, what a story with Kay Bailey Hutchison, because when she's been plotting this run for a long time and began plotting it when Perry was actually quite unpopular. But Texas is in relatively good fiscal shape compared to the other states. And here she is. She may actually lose this thing. And in fact, is expected to lose it.
Incredible. And we're going to talk a little bit later with one of the top political reporters in Texas, Wayne Slater of the Dallas Morning News. But we begin up on Capitol Hill, where Senator Lamar Alexander, Republican of Tennessee, joins us. Senator Alexander, you've been all over the place in the last couple of days, the main point person at the forum on Thursday. I want to ask you, picking up on something you said in this week interview yesterday, Senator, you talked about if this passes, there would immediately be an effort to repeal it. Is that something that Republicans are coalescing behind? Will there be, if you take control of Congress, either the House or the Senate, will there be a repeal effort that we can expect next year?
Well, that's just my own opinion, but I certainly think so. I mean, the reason the late Pat Moynihan said that we never have passed a major social piece of legislation except by bipartisan vote, like the Civil Rights Bill, is because we not only wanted to pass it, we wanted the country to accept it. So we're going to jam it through in a partisan way, which will take 2 or 3 messy months here. I'm pretty sure that the rest of the year is going to be defined by a movement to repeal it, an election to repeal it, with the health care bill, which is unpopular, defining the race for every single Democratic candidate for Congress.
All right, so Senator, we were just talking before the show about reconciliation. If the Democrats succeed in jamming this through on reconciliation, would you be open to using the very same process, reconciliation, to repeal health care reform?
Well, I don't like using the reconciliation for this. I've tried to be consistent in my views. For example, I complained when the Democrats blocked President Bush's nominees, and so I voted to give President Obama's nominees an up or down vote. But let's just take the current moment. The American people have tried to say to the Democratic majority in every way they know how, in elections, in public opinion surveys, in town meetings, we don't want this bill. And if the Democrats pass it, they'll be saying, we don't care what you think, we're going to jam it through. And so that produces the rest of the year in an effort to repeal what they passed.
Senator, I wanted to press that point a little bit. It seems like a critical point. I mean, the Republicans obviously want to be entrusted with control of Congress again, want to take over the Senate. Is reconciliation something that you'd say we would never use for something substantive legislation like health care? Are you prepared to make that kind of statement?
No, I'm not going to prepare to make any kind of statement. I'm prepared to say it shouldn't be done now, and if it shouldn't be done now, it shouldn't be done in the future. But the point of the matter is it's never been used for such a exhaustive, huge bill that would rewrite 17% of the economy. Senator Byrd's been consistent about that. Senator Conrad has been consistent about that. Senator Frist was consistent about it when Republicans wanted him to take the prescription drug benefit through on a reconciliation bill. So hopefully the president will decide that it would be better to take the ideas that we talked about last Thursday that we agree upon and put this bill aside, establish reducing cost as our goal, and go step by step toward that goal.
I just want to be clear. You're not ruling out then, if they do use this and they do jam this through with 51 votes, you do not rule out using the same process to undo it?
It's not my responsibility to try to predict the future. It's my responsibility to say what should happen today. And what should happen today is it shouldn't be jammed through by any procedure that makes it purely partisan, because the goal with a big piece of social legislation is to have a bipartisan result so the country will accept it, and I hope that's still what happens.
What kind of impact would you foresee if this is done procedurally? Obviously, there's one question about what happens in the election, but there's still another 9 months before then. Is this something that Republicans would view as a message that you've got to use more techniques to try to hold things up, because it's clear where Democrats are going?
Well, first, it's going to be a big legislative mess just to try to pass it. It'll probably take 2 or 3 months. And what people don't realize, there are a lot of technical problems here. For example, under the rules, this reconciliation rule, abortion probably can't be changed this way. Probably you can't include wellness and prevention, which most of us are for. It may not be possible to include the insurance reforms about pre-existing condition, and then add to that the fact that under the budget rules, the taxes might expire in 5 years or 10 years, so you'd be passing a bill where the benefits start in 4 years and the taxes expire in 5 years. Then there's an opportunity for unlimited amendments. So you're going to have an outraged country, you're going to have a messy process, and then you're going to finish the year with a big effort to repeal it, which defines every Democrat's race. That's what will dominate the rest of the legislative year if they try to jam this through.
Well, it sounds like a full employment opportunity for political reporters at any rate. But Senator, if I can switch subjects, your colleague, Senator Jim Bunning, as you know, blocked this effort to extend unemployment benefits, COBRA, the Highway Trust Fund. And now today we're seeing workers furloughed at the Transportation Department on highway projects all around the country. And we are also seeing people begin to lose their unemployment benefits as of yesterday. Have you talked to Senator Bunning about this? Would you like to see him drop his objection?
I haven't talked to him about it, but here's what he's saying. He's saying to the Democratic majority, look, if you're going to spend $10 billion, you got to pay for it. I mean, about 2 weeks ago, the Democrats pushed through a toothless Swiss cheese proposal they were bragging about, saying, we're going to pay as we go. And then the next thing you know, they turn around and offer $10 billion at the last minute to do what you just described without paying for it. And Senator Bunning didn't like it. He's right not to like it.
Senator, before we let you go, I wanted to ask you about your colleague, another colleague, Jim DeMint, who has gotten involved in primary races all around the country, including going very aggressively against candidates that party leaders in Washington have recruited to run in places like California and Texas. I mean, California and Florida. What do you make of that effort?
Jim DeMint's one of the most valuable members of our Republican caucus, and he and John Cornyn, who's our chief recruiter, have a good understanding. We don't pick nominees. We recruit nominees, and then the people of Florida or Ohio or New Hampshire or Tennessee decide who to elect. So Jim DeMint's got a perfect right to endorse whomever he wants. John Cornyn's got a right to recruit whomever he wants. The fact is, we've got more good candidates running in Republican primaries this year than we've had in the last 10, and I think that speaks pretty well for our prospects in November.
By the way, we noticed looking on his PAC website that he has ratings for all the Senate colleagues, Jim DeMint does, and he rates you only a 70%. That's about a C- and one of the lowest in the Republican caucus.
Well, I don't think it's a good idea for us to give grades to each other. I think that people should grade one another. Jim's very constructive. That's not one of his more constructive things, if that's what he's doing.
All right, Senator Lamar Alexander of Tennessee, appreciate you being with us. Thank you so much.